President Calderon that there's a two-way street in terms of the problems of transnational drug operations. The Mexican government, I think, has been very courageous in taking on these cartels at great cost, obviously, with respect to violence in Mexico. That's the right thing to do. We have to be a more effective partner in both reducing demand for drugs here in the United States and for stemming the flow of weapons and cash that help to finance and facilitate these cartels. So we're working very hard to have a much more effective interdiction effort of south to north or north to south traffic than we have in the past. So we are checking southbound transit to try to capture illegal guns, illegal cash transfers to drug cartels. It is something that we have been building over the last couple of years. It's not yet finished. And there's going to be more work to do. Part of the issue here, obviously, is budgetary. At a time when the federal government is looking for ways to save money, we're going to have to figure out ways to operate smarter and more effective in our investigations without a huge expansion of resources, because those resources aren't there.
And in terms of the demand here in the U.S., what kind of efforts?
With respect to demand in the U.S., our drug czar here in the United States, I think, has done a very good job working with schools and local communities, working with local law enforcement to try to continue to reduce drug demand. One of the things that I've always believed is that, and this is reflective in my administration's policy, is that we can't just think about this as a law enforcement issue. We also have to think of it as a public health issue. If you think about the enormous changes that have been made in terms of people's use of tobacco, for example, that wasn't because of they were arrested. It was also because young people were taught that smoking was bad for your health. Didn't make you cool. There were public service announcements, right? So, I think taking a comprehensive approach that includes interdiction and law enforcement, but also takes into account public health strategies, treatment. In a lot of cities around the country, if you decide that you want to rid yourself of drugs, you may have to wait 3 months, 6 months to get into a local treatment program. That's not going to be particularly effective. So what we've been trying to see is, can we get more resources into treatment, more resources into a public health approach, even as we continue to target the cartels, the drug kingpins, those who are really responsible for perpetrating the drug trade in communities across the country.